Good evening. My name is Daniel Dawes, and I'm the Executive Director of the Satcher Health Leadership Institute at Morehouse School of Medicine. I want to welcome everyone to our special webinar series intended to engage our community in conversation around COVID-related issues disproportionately impacting people of color, people with disabilities, and other groups. The Morehouse School of Medicine's National COVID-19 Resiliency Network was created to provide awareness of critical health information and linkage to services to help families and individuals recover from difficulties that may have been caused or worsened by the coronavirus pandemic. Today, we are privileged to be joined by a very special friend and exceptional leader in the movement to advance health equity and mitigate the impact that this COVID pandemic is having on communities across the United States. Of course, I'm talking about Dr. Marcella Nunez-Smith, who currently serves as the Senior Advisor to the White House COVID-19 Response Team and Chair of the Presidential COVID-19 Health Equity Task Force. When she's not advising the White House and our federal agencies, Dr. Nunez-Smith serves as the Associate Dean for Health Equity Research, the CNH Long Professor of Medicine, Public Health and Management, and the Director of the Equity Research and Innovation Center at Yale. Thank you so much for joining us tonight, Dr. Nunez-Smith.
Oh, thank you. It is my pleasure to be here, friend. Just so thrilled to be in conversation with you. I want to thank you especially, as well as Morehouse, for just the tremendous leadership during a really difficult time. We're not out of the pandemic yet. We're going to talk about that, but thanks for all you're doing.
Well, thank you, and you honor us with your presence this evening. So let me begin our discussion by posing this question to you first. As you know, there is no denying the fact that COVID-19 has changed everyday life for all of us in a multitude of ways, and that our country is experiencing a dark and historical moment. As the death toll reaches nearly 610,000, the COVID-19 pandemic has laid bare inequities within the U.S. health system and our society at large. And as you know, people with disabilities, people of color, they bear an unequal burden. As researchers have reported, these groups are more likely to contract the disease, 3 times as likely to end up in the hospital, and twice as likely or more, depending on the group, to die from it. While there have been challenges, there's certainly been many successes as well. So would you share with us what strategies the administration has implemented to ensure equitable access to the vaccine?
Yes, let me tell you, I always have to take a moment when I hear the statistics, because they're hard. They're hard to hear.
Absolutely.
And we often don't acknowledge, I think, the grief and the suffering behind those numbers. And so we know, right, that in our communities, we are carrying that burden and the mental health toll that takes, right? Grieving for loved ones. We have to talk more about long COVID as well. So those who have contracted COVID and dealing with lingering symptoms also burden our communities. The economic impact, the educational impact, it's a lot. And so to hold that. And at the same time to say, President Biden came in, Vice President Harris came in, the charge was clear from them to all of us, to the entire administration. We're going to have a whole of government approach to COVID-19. We're going to make sure that this is fast work because there's urgency to this. It's going to be efficient. It's going to be equitable, right? And to underscore that over and over again. And so just in the first couple of weeks of that administration, already President Biden launched several vaccination channels. Now, these are ways the federal government was getting vaccination directly to the people who needed it most. And so standing up partnerships with our federally qualified community health centers and community health centers all around the country, thinking about those large vaccination sites, but placing them in neighborhoods that were the hardest hit. Thinking about the retail pharmacy programs, partnering with them, also saying equity is going to be at the core. Where are we going to be located? Knowing that the vaccination venue is necessary and sufficient. And of course, mobile vaccination. That was the first phase. And the work has continued. People are working just around the clock in the administration. I mean, all over, but certainly the president has made it really clear this is priority number one. And so moving on to make sure structural barriers are addressed. Everyone knows too well. We have to have conversations about things like transportation, right? Really important. Childcare, paid time off. I mean, we heard over and over again, we're honored in the White House to be in conversation with many, many folks who are showing up every day. You know, you have been gracious enough to come tell us your wisdom, your expertise, to share with us the knowledge you have about what's happening on the front lines in the vaccination campaign. And responding through partnerships that are private sector, include partnerships with philanthropy. You know, this is always the key, the collaboration, the partnership, community-based organizations, faith-based organizations, kind of everyone stepping up in this moment. And now the phase of work that we're in, really important. We know vaccination, ease, convenience is critically important, but we got to fight the misinformation, the disinformation that's out there. That's the greatest threat right now. We have to make sure that people have not just accurate information, the vaccines are effective, they work, right? Even now, we know we're watching Delta and other variants, but the vaccinations confer a high degree of protection, keep people out of the hospital, keep people alive, right? So we know that, but also, you know, people are wondering about charges and cost, and vaccination is free. Proof of insurance is not needed. Documentation does not matter, right? No government issued ID is needed. So making sure that we're getting out there, working so closely with trusted messengers. This work is person by person right now, right? Hyper local work. Everybody knows in the equity space, we always have to begin and end there. And I just want to say thank you, because I know kind of all the folks who are joining us now, each one of you, what you're doing is making a huge difference. When you stop and talk to somebody about your vaccination story, you're making a huge, huge difference. You're saving a life, and every life is worth that time for that one-on-one investment. And that's where we are right now.
Well, it certainly sounds like, you and the Biden administration have been quite busy. I think that would be an understatement, right? And I want to thank you for your leadership in this space and trying to keep us all safe. You know, I'd like to pivot a bit now to include a discussion on children specifically. How are you planning to make children, or make sure that children who are 12 and older also have equitable access? And how can parents access the vaccine for their children? Could you give us some insights into that?
Absolutely. So, right, you know, the point now is that in the US, for everyone 12 and over, you're eligible, and the supply is there. So important. But we know it's got to be easy, convenient, really important. We got to meet people where they are. You know, it's wonderful to be able to go to your local pharmacy. We're continuing that partnership there to be able to get vaccinated. We know our local pharmacists much of the time can ask information, ask questions, get information we need from the pharmacists in our communities, but also from the clinicians we know. And for so many of us, I'm a parent as well, right? We're very used to talking to our pediatric providers or family doc and family providers about our children's health. And so making sure that vaccination is available in those locations as well. And so in this phase, making sure vaccine is there in doctors' offices around the country so people can get vaccinated. Again, places that they trust and where it's easy and where it's convenient. We know, of course, that the challenges are many and can be many for those who are trying to connect with vaccination. And so always paying attention to access is going to be number one, and good information. And so when it comes to the younger folks among us, we want to make sure they have information from people they know and trust as well. So partner with many influencers and peers so that they are hearing in all those platforms. You know, I don't have to name them. If you're a parent of an adolescent, you know where our children are spending their time, but making sure they're getting good information where they are spending their time, meeting them where they are as well, and making sure it's easy and convenient for parents. Equity is going to be key for our children as well as for our adults.
Well, thank you for that. And since we only have a few minutes left, I'd like to close by asking you, since this is a conversation with community members, if you would share with us how members of our community may engage with the Biden administration on efforts to mitigate the impact of COVID-19 on their communities.
Yeah. And we started off at the top of our time together talking about this, right? And so, you know, we are in this COVID-19 moment, and absolutely we want to make sure that there is equity, and we're hearing about that people are able to connect with all the COVID-19 resources, be it vaccine and vaccination, testing, therapies for COVID-19, PPE, but this broader conversation, because we know the impacts and we know that this is the result of what has been intergenerational limitation, right? In terms of access to resource that's been systematic, that's been structural. And looking ahead, this is an opportunity, a moment to address really. And that is the charge of the president. How do we make sure that we mitigate now and moving forward the impact from COVID-19 on communities that have often been minoritized and marginalized and medically underserved? And so we want to hear, there are phenomenal ideas in every corner. And so I want to invite people into this continued conversation that we're just starting today. Be sure to reach out, whether it's to us on the COVID-19 response team in the White House, or to the task force that we referenced earlier. We have monthly public facing meetings. We invite people to come into the meeting and share public comment and perspective, and just to reach out to us and let us know what you're learning, what you're seeing, and what those good ideas are. Together is how we're going to get through this and to the other side. And I'm grateful for the work we're all doing together as a collective. This is the only way, but let me tell you, I have hope. I'm holding it. I'm holding optimism. I'm holding light and strength for us all, because we can get to the other side of the pandemic.
Well, what powerful words to end on. And I want to thank you so much, Dr. Marcella Nunez-Smith, for the privilege of your time. We appreciate you. And again, just letting you know that as you fight for us, we also are fighting for you. And we thank you again for all that you do on our behalf. On behalf of the National COVID-19 Resiliency Network, we wish you a good night. Godspeed. Thanks again.